Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our Hospital System General Director. Today is Tuesday, December 15th, giving you the update from Albany Med. All right, we have some really exciting news to talk about, but first we need to go over some COVID numbers. Let's pop up the first graph. This is the Capital Region, 8 counties. Fred, this graph shows 269 people admitted to the hospital. I know we had our regional call today. The graph actually lags by a couple days. The number is higher than that.
It actually is, Dennis. In our regional call, we encompass a little bit more in the Capital Region because that's our service area.
Right.
So today's number was 349.
Right, and I think you said that the numbers went up by about 20% from last week.
That's right, Dennis.
So clearly the numbers continue to go up, and that's why we pay so close attention to it. Next graph, these are admissions and discharges here at the medical center. This is the full run. We've been showing this back to March now because I think it does give some perspective.
Yes, it does. You
can see a lot of activity here on this campus, particularly above the line. Yesterday, 14 admissions.
And I think that's the most we've seen in a day thus far.
Next graph is the morning census here on this campus, people currently in the hospital with COVID. This does include people who are no longer actively being treated, but the number is still a higher number than we've seen, 78. The breakdown is 63 on the floor, 15 in the ICU. Now we have 4 on ventilators.
That's right, Dennis.
And Fred, when we spoke to the area hospitals today, they were also describing similar numbers of growth.
That's right. Similar numbers of growth, similar numbers percentage-wise in the ICU and ventilated.
So before we get into what I think is a really good news story, as does Dr. Venditti, we still want to emphasize, although we're talking about the way forward with the vaccines, still a lot of work to do with the things we've already been doing: social distancing, wearing a mask, hand hygiene.
You know, Dennis, the vaccine is really a tremendous medical breakthrough for us, but it's going to take months, literally 6 months, before we see the full effect of it. So we really have to continue to do all those things that are very important to prevent spread.
Right, and we don't want to mix those messages up.
Absolutely.
So, that being said, let's flip over to some really great news. Yesterday, as reported, the first COVID-19 vaccines being delivered and administered here at Albany Medical Center on our campus. We had a great press event. Fred, you were obviously there. The first 5 people to get it were representation of our workforce. We had a physician, we had a nurse, we had a respiratory therapist, we had an ASA, and we had someone from environmental services.
That's right.
And the first person to get it was Cindy Tanksley, who's been an employee here for 40 years. She's a dear friend of mine. I've known her from the ED. One of the first faces you see when you come in the emergency department.
That's right.
And in some ways, the perfect person to represent us at the medical center. What are your thoughts?
In many ways, Dennis, because she is the first person. So, you know, she's just an absolute pleasure. So that's really tremendous. But because she's the first person, a lot of unknowns walk in. Where we don't know, is this a patient with COVID or not? So she's somebody who's really at risk. So getting her vaccinated and others that work on that front line is very important.
There are so many people to thank to get to yesterday. Fred, you're absolutely one of them.
Thank you.
Dan Pose, incredible. Anthony Desperito, so many. Scott Heller. So we'll forget some, but I wanted to name a couple very quickly. As soon as we were done with those 5, we started to vaccinate more.
That's right.
And I think we got up to?
So we vaccinated 100 people total in under 2 hours yesterday. So the system that they set up was slick, Dennis. It worked extraordinarily well, the registration process, all of it. And they're down there right now. We started again at 1 o'clock. And in the first hour, we vaccinated again over another 100 people.
And like I said yesterday, I mean, make no mistake about it, there's tremendous amount of work to be done going forward, but vaccinating people starting yesterday, this is the beginning of the end. We have so much work to do, but getting these people vaccinated is important. Fred, how did we prioritize people? Why did we start with the areas we started with?
So Dennis, we started with those areas where people either are at most risk. So think of the emergency department where people come in and we don't know what illness they have, and they could have COVID. The ICUs where there's a lot going on, even with the COVID positive patients that we know about that could infect someone. And also in areas where people, if they were our employees and they had COVID, could harm a patient by transmitting it to them. So intensive care units really fall into that category. So those were at the top. We went through, I'm sorry.
I was going to say, and those 5 people we chose, although 5 different disciplines, they work in those areas.
Exactly.
Okay, good.
The group went through a whole process thinking about those elements. Also using the guidance from the Department of Health. So the
Right.
Department of Health has some pretty significant guidance on how we should prioritize healthcare workers for the vaccine. So they spent a lot of time, the bioethics folks were involved, pharmacy, logistics people. You know, it was a real comprehensive group
Right.
that came up with the prioritization and the plan.
And you gave credit very appropriately to Dr. Dan Poise helping lead that
Absolutely.
effort with Dr. Megan Applewhite.
He did a tremendous job.
They sure both did. Fred, you surveyed our staff, over 1,000 people a couple weeks ago. We
Yes.
talked about this here. Over 80% said they would take it, which is interesting because I heard on the news yesterday another poll in the communities where the similar number was given. Are we mandating the vaccine?
We're not, Dennis. So this is a new vaccine. You know, we mandate the flu vaccine, but
Right.
the flu vaccine's been around for, you know, decades.
Right.
So it's a little bit different circumstance. We think it's important that our staff get vaccinated. And, you know, think of it from this perspective. If we can get 80% of our staff vaccinated,
Yep.
we create a bit of a bubble here
Yep.
where it's less likely that there'll be transmission
Right.
within the organization. So if you're one of our staff and you're thinking about getting vaccinated, it's important for you personally, but it's also important for the patients that we care for in this organization.
Absolutely. I was stopped in the hall today by no less than a dozen people who said they're excited it's here. When can they get theirs? A couple of people asked about the safety of it, and I said I think it's incredibly safe, and I would give it to any member of my family for sure.
So, you know, the raw data's out there. The FDA has published it, and today actually they released the Moderna data.
Tell us about Moderna.
So Moderna is going to be the second vaccine that's going to be available. So they've applied for the same kind of emergency use authorization that Pfizer applied for. The data was submitted to the FDA. The FDA compiled that, actually published it online today, 54 pages if you're interested.
You read it.
And I've looked at it. And it talks about the efficacy, so how successful it is at preventing the virus from causing COVID, as well as the safety profile.
Right.
And frankly, Dennis, it looks very similar, if not identical, to the Pfizer data.
So the vaccine we gave yesterday was Pfizer, which has been reported requires a freezer that can take to very low temperatures. That's important for transportation and storage. Moderna, we don't think has that same level of requirements.
That's right.
But people have said, well, if we're getting Pfizer this week and if we have Moderna next week, you know, should I wait? Is one better than the other? My answer has been, I think both of these vaccines are effective and safe. I would be comfortable with either one, and that would be my message. The difference in them is really more about the logistics and other issues other than the safety profile.
That's right, Dennis. I think there are two things. So with Moderna, your booster shot's 4 weeks later.
Right.
With Pfizer, it's 3 weeks later.
Okay.
And then the storage, which is important later down the road when we start to distribute this out in the community. You know, the Moderna vaccine will last in a standard freezer, not an ultra-cold freezer, for 6 months.
Right.
And even in the refrigerator for a month.
All right, last question on the vaccine, and then we have another bit of exciting news. What are the next steps? What are we doing as far as next steps here for vaccine? Just continuing to roll it out, other tiers?
So we're going to continue to roll it out on tiers. As I said, people yesterday and today will need to get their booster shots in 3 weeks, so that's planning that we were already doing. And I think it's important, Dennis, certain things don't change right away. So we're still going to wear masks.
Right.
We're still going to need to wash our hands. We're still going to need to socially distance.
Right.
We have to get to a different place, which is literally 6, 7, 8 months down the road before some of that will hopefully go away.
All right, well, still a historic day here. Credit to so many
Absolutely.
people. It was great to be part of it, and really looking forward to the next couple weeks to months. Finally, an incredible honor was given to one of our incredible employees yesterday. Employee of the Year. Doesn't get any better than that. An absolutely worthy recipient of that, named?
Don Tessitore.
For sure. So Don was a nurse, and then he became a nurse practitioner. Still a nurse, but a nurse practitioner. Works on our hospitalist unit. Takes care of COVID patients.
Works nights.
Nighttime.
Yeah. Just a tremendous guy. Shout out to him. Congratulations.
For sure. I think he received well over 100 letters of support, and the things they said about him were incredible. And it was fun last night because he came through and got his vaccine
Yes.
and got a second round of applause. So congratulations to Don. I know him.
Congratulations.
He's a great employee, and we really do congratulate him. And we thank everybody for recognizing him.
Yes.
We had many candidates,
Yes.
all incredible, but congratulations to him.
Congratulations.
Okay, we'll be back again on Thursday, no doubt, with some update on the status of our vaccination and other numbers as well.
That's right.
All right, we'll see you in 2 days. We ask that you once again, please take care of yourself, take care of each other, and we'll see you on Thursday.